Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm delighted to be joined for my News You Can Use episode for the month of September by Doug Goldstein. Doug is a leading executive who specializes in digital health and digital therapeutics, and he works with a wide range of companies, supporting them through their growth period. He can be found on eFuturist. He's also a good friend and occasionally tipples with me in whiskey. Doug, thanks for joining me today.
Good morning, Nick. It's great to be here, and I'm fresh off the 13th annual Health 2.0 and AdvaMed. So lots of insights on the latest important developments in the field.
Fantastic. So let's kick off with that because I think, from a conference standpoint, certainly the latest and greatest of what's going on. Tell us a little bit about what you saw at those conferences. What were some of the exciting pieces of news and innovation that you saw at Health 2.0 and AdvaMed?
Well, I think there's an increasing acceptance and application of advanced technology. So we're at a very interesting place. So we've digitized people's lives. We walk around with mobile phones and various internet-connected devices. So we've created huge data sets. Those data sets are now available to be mined by artificial intelligence. And artificial intelligence is much more cost-effective because of the drop in computing power. So a lot of people put AI, one overall observation is a lot of people put AI as kind of a separate application. And I put it as a core element of how we're going to rework every process, whether it's an internal health or medical process or a customer, citizen, patient-facing process. So just like the web changed how we lived our lives, and then we taught everybody how to use mobile apps, and now everybody's learning how to replace touching mobile apps with voice. And voice is a core natural language processing core part of AI. So AI is going to be reworking every process we experience in our daily lives at work or at play. So that's one of my overarching observations from the conferences. From a practical standpoint, the adoption of digital health and this field now called software as medicine or digital therapeutics has been extreme by health systems, pharma companies, medical device leaders. So, and in fact, now we have this whole therapy area. The FDA has approved software as medicine to treat depression or smoking cessation. And we've seen $1 billion rush into that space. Well, over the last 5 years, $1 billion. And it ranges from companies that have been around for 10 plus years, Volantis and WellDoc. And then we have new entrants, Pear Therapeutics, that really are beginning to address and really say, how do we help people better manage their medication? First, if people don't take their meds, it ain't therapy. So these wraparound digital therapeutics are helping to remind people, they're helping to report back status, perhaps how well people are, improving their likelihood to reduce cancer recurrence, a whole variety of things. So the adoption, the integration to the traditional pharma process or the medical device process has been extreme, and it's one of the big insights I have coming off both AdvaMed and Health 2.0.
So I agree with you on the AI. I think it's just going to be embedded in everything. But one of the fundamentals in that is data. We have to have the data. How do we acquire all of this data? Where are we getting all this stuff from that's going to contribute to that will actually make these AIs useful? Because everything I understand about the machine learning and artificial intelligence is data is the lifeblood of this. And if you don't have the source, you can't produce the insights to develop actual utility, right?
Well, that is correct, but we've been generating these data sources. The challenge isn't whether the data exists right now. It's the bigger challenge is the integration of the data amidst the regulations that exist in health and medical care. So it's more of a data integration challenge given the regulatory issues around data blocking. Whose revenue is it? How do I make revenue from it? But you have venture-backed companies like Carrot Health that have built a profile on every American across integrating multiple data sources. Some of those they've had to pay for. Others are public data sets that have been created out there that talk about various elements of social determinants of health. Federal government data sets on claims for Medicare and Medicaid patients. And then you have major players, United Health Group's Optum's. I had a very interesting conversation with one of their executives about imagine all the claims they have, all the data they have access to from the medical interactions that they identify from claims, and then they start overlaying that with second and third party data sets that are on the market right now. I mean, within 7 milliseconds of myself doing a search on the internet or touching one of the apps on my phone, that data of that action is in a database and it's being sold within nanoseconds.
It sounds kind of creepy, doesn't it? The instant, but we all have that experience, right? We're searching on the web for something, and then suddenly all these adverts show up, and that's some of the passive activity and I think negativity around it. But from a healthcare standpoint, you're right. So I interviewed the CMO for Carrot Health. I'll put the link to that in the show notes. And what was really intriguing about that was that, as he put it, the supermarket knew more about your health status than the physician in his office and could predict your HB1AC based on the data that they had. That was really what set him on the path. Right. And here we are sort of trying to combine. It's interesting you say that sort of integration. So, the data exists, but we're not tying it together. Any standouts at the conference that you thought, wow, that's really interesting? I see that as sort of progressing into the future of those spaces.
Well, the standout part of AvaMed was that 3 years ago, they set up a digital health center as part of their medical tech. So AvaMed is the largest association of medical device companies. So the digital health center is a way, and they have most major pharmas, ResMed, the CEO of ResMed is the chair of that, but we're not just talking about they set it up, this year. They set it up 3 years ago. They've got significant traction. And so that was a big standout. And also the theme, there was an entire track, and they only had 2 or 3 tracks going on at the same time, but there was an entire track dedicated to digital health and diversity, digital health internationally, digital health as it relates to pharma, digital health through medical devices. And the other thing that I'm seeing, and I have seen, so I did spend 4 years at Inova Health Systems, their Center for Personalized Health, as their lead innovation officer. So I did interact with over 50 pharma and medical device companies in that process as we work to develop strategic business and financial arrangements that would fund this next generation of research at the intersection of digital and omics. But one of the things I realized is that the silos of pharma are being blurred because pharma is integrating or acquiring various digital assets or device assets. Also, medical device companies are including pharmacological solutions or acquisitions depending on the condition they're addressing. And ResMed is actually a pretty good example of an organization with COPD and sleep apnea applications that the CEO roughly 5 years ago acquired a major SaaS platform so he could better service both the clinicians prescribing their therapies and their patients. So this concept of digital therapeutics being supported by a SaaS platform is being executed. We're 5 and 10 years in, and he's got his data on, he made an $800 million investment, and it's now accounting for 19% of the profitability. And it's essentially a whole new line of services, much like Amazon started off selling books, and now Amazon is in the cloud business. Major opportunities are seen at these forefronts of technological innovations for the organizations that have the right leadership and access to capital to be able to, and willing to take risk to go where the trends are going, as opposed to just doubling down on your core business, as we see some health systems do.
So you bring up Amazon. Recent news, they had a bunch of announcements. Anything that stood out to you in all of that? I certainly had some views.
Well, so it goes beyond Amazon, right? We have I believe that health systems, for the most part, health systems do not understand citizens. They have physician relationship management systems. They're a wholesale element. Yes, they talk about the consumer experience, the patient experience, but they don't really have advanced, or they don't apply advanced customer relationship management systems. We have CVS acquiring Aetna. We have United Health Group moving significantly into the provider space, not buying hospitals, but buying alternate sites of care. We have the rise of the home business. So Best Buy in Forbes just yesterday indicated that healthcare is going to be a significant part of their business. They acquired Great Call for $800 million. They currently service 1 million seniors in various home-based health-related, medical-related services. They project serving 5 million people in the next 5 years, and they see it growing to 10 to 15, maybe even the most significant part of Best Buy's business over the next 20 years. Pretty significant consumer players recognizing, they called it a $50 billion market in terms of senior home care, remote-based monitoring, chronic care management, anywhere but a hospital or a clinic. Some of the work that I've been doing and I've been analyzing the space deeply for several clients over the past 2 years after leaving Innova, as I've also deep dived and gone back and got a certificate in AI from MIT. But I recently have guided a company called Moterum Technologies in an integration but focused on telemedicine, telehealth, virtual visits, but specifically on stroke and Parkinson's patients. Those are chronic conditions. People's functional status can be improved outside the clinic through a comprehensive use of devices along with sensors. So stroke and Parkinson's patients have very different gaits and mechanics than walking mechanics than normal people. So that company has 10 years of specialized research to get the noise out of it and improve the accuracy, to have better understanding of their cadence and symmetry, and have integrated a digital therapeutic platform that was specifically developed to have therapies, activities, exercises, educational material that are configured into personalized therapies by an AI agent to support an individual Parkinson's or stroke patient to rehab in their homes. So we're seeing a subspecialization out of this general physical therapy or virtual visit space by Moterum and other companies. So it really says, and look, the shift of healthcare from a hospital to an outpatient clinic to the home is not new. Those trends have been in place for 50 years. But now it's the home and then anywhere somebody is. And back to your question. So Amazon is surrounding us with devices, right? I have Siri here, and unfortunately she's turned off and not listening. Otherwise she'd be talking back to me right now. Same thing with Alexa. So we're surrounded by voice agents, and now those voice agents are becoming even more portable. So Amazon announced a whole new Echo line of products, including a Ring, where I can speak to my finger. I don't have to speak to my watch anymore, but I can just speak to my finger. And the question is, how fast and who's going to be the early adopter and how far it spreads through the population. We've seen Siri and Alexa spread from the early adopters very quickly into the senior community. And, I call voice, and Nick, with your experience in this generation of natural language processing and voice, I call voice the original interface. Well, yeah, probably voice even before sticks and stones. So we're back to the original interface. We taught everybody to use a keyboard, then we taught everybody how to touch phones and live inside a little, window. And now we're back to just talking. So the concept of ubiquitous computing is upon us, where the computing's just in the walls, it's in the devices, it's in our rings, and soon it'll be in nanobots floating around in our brain. So why speak it when I can just think it and make it happen?
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to my good friend, e-futurist, that's Doug Goldstein. We're talking about news you can use for September 2019. We were just talking about voice and the innovation around that, and some of the move from the medical setting to the home setting. And, one of the things that I'm often heard to say is that there's almost nobody that wakes up in the morning going, I want to move into a hospital to end my life. That's really not the reality. We all want to age in our home, and everything is sort of shifting. We see that with, the likes of Best Buy, who are stepping into this. In fact, it feels like every man and his dog is sort of inserting themselves into this healthcare space. And, the one message I have for all of those folks is it's a hell of a lot more complicated than you think from the outside. You look at it and go, oh my goodness, I can fix this. But then back to the voice, and this is a space I've spent a long time in, and you're right, it's the original interface. There is nothing that predates it in my mind. And what we clearly understand about that is that people can communicate with voice even at very low intelligence levels, low levels of sophistication, long before we can write and do all of those things. And when you look back at the history of the typewriter and even the keyboard, which, this continues to blow my mind, why was it designed the way that it was designed? To slow you down. It was designed to physically make it as hard as possible to type those words, because the keyboard, the physical keyboard and the keys that went up, were struggling. If you had the keys that you could hit really quickly, they were actually interacting and stopping and, causing a mechanical failure of this typing. So then we have all the typing classes, and, we've moved past all of this into this world of voice. And you bring up the ring. So let's talk a little bit about that, because I looked at that and thought, wait, Dick Tracy, you're out of the door now. There's no more watches. It's just the ring. And I'm certainly intrigued by rings. The Aura ring, which is actually a sensor built in. It's not just a microphone. And what I question about this whole thing from Amazon is, where's the feedback? Are you hearing it through the speaker? Because one of the challenges of this interaction that we're trying to deliver is we struggle with privacy. So, and I can't tell you how irritating it is to sit on a plane or sit in a public space and listen to a whole conversation. And sometimes it's both sides, because people seem to be using their speakerphone to listen to a conversation. Hello, we've got a headphone, or we could, at least keep that private. But, you hear one side of it. And for most of us, we don't want that, but we haven't solved that. Maybe the ring does, because it's a little bit more private. Where do you see this voice interface? Is it going to replace the keyboard? Will this just disappear from my PC? Do we just move away from all of these interfaces and it's all going to be voice a la Star Trek?
Well, I think it will take a while. I mean, we still have radio, and we still have technology. We're adding to the choices of interfaces. So, there's a wonderful Wired magazine in their science fiction issue called Subtext, where who needs voice when I can just think it? So I think for me, and part of this is my training, I compose much quicker on a keyboard than if I were to think it. I would have to retrain how I think, but we are retraining people's brains with these different technologies. So conceivably 20, 30 years in the future, there's much, much less use of a keyboard. There's probably still a few people out there using Selectric typewriters, but it's not a big market. And
I
so
wonder if that's even a market. I've got to go and look now because I'm really curious because I remember that. But you're right. Despite all of my history in voice and speech recognition and access to all of this technology, I'm with you. I still need that thinking time. And it's because I'm such a poor typist. And, most people can establish that just based on my writing because it's full of all these typing mistakes, although there's tools that help me with that. But I love that idea of thinking, although it's a little bit terrifying because I think something and then I pull back from that. But we've seen some technology around that for sure that sort of senses brain waves. We're seeing it with the
right.
disabled, right?
Yeah, Halo neurosciences. But, for instance, I'll take physicians. Nick, as a physician, you were trained to dictate. You have dictation skills, which teaches thought patterns in a way that can be easily, so it's a certain flow. So I was never trained in dictation. I was trained to type. So getting information out or getting it recorded is easier for me to type because I never trained at dictation. So I think that we'll have, it's interesting. Let's take the phonograph, right? We thought the phonograph was dead, but vinyl's back. And
Are you talking about the presidential discussion or the presidential reference in the presidential race
no,
for the phonograph?
I'm just saying that the growth of vinyl albums and the technology and the adoption. My son just started college and his roommate had vinyl. Another 18-year-old kid, he walked in and had vinyls with the whole range of records.
I just want to say at this point right now, I've got 2 boxes in my basement. I'm willing to sell them. They'd be very expensive at this point. That's fascinating. Why, though? Why?
Some people talk about the sound quality, but once again, so I think that we create technologies and they'll persist for a long time. The issue is what becomes dominant. I think the clear movement to voice, whether the voice is picked up by a ring or a speaker or a phone, voice is just easier. It's very transactional right now, but I'm advising a company that has got Alexa listening for 30 seconds. It has much more of a relationship bot. I think, I'm very frustrated by punch, 10 selections. Punch 1-1 if you want this, punch 2-2 if you want that. I'd much rather say, provide a human. I think that voice and a relationship bot is a front end to the call centers because ultimately I think many people, millennials, seniors, Gen Xers, we want to get to a human. But right. If we have an interface, we're very comfortable. Many people are getting very, very comfortable interacting with Siri for transactions. It's moving into interaction for more of a relationship or a question and answer. And Tuzag, a company, tuzag.co, has the ability to have Alexa listening. It's based on actually 20 years of advertising technology and micro-personalization. So whether that personalization is a voice interaction or whether it's putting specific content that is going to resonate with someone with an 8th grade education versus a 12th grade education in a text message or a print document. So what we're seeing is really this micro personalization down to who you are and what's going to motivate you. And as that relates to healthcare, we need to move from viewing people as consumers, because the overconsumption of planetary resources or food is a major driver of chronic diseases. So we have to view us and all of the people we interact with as, I think, sustainers or citizens. And the term of citizen, whether we're a citizen in the United States or the citizen of the planet Earth, denotes responsibility. So I think that as we apply all these technologies, every technology, whether it's a hammer AI, can be used for good or it can be used for evil. I can use a hammer for breaking and entering, right, or I can use it to build a house. And we have that same challenge. We need to apply wisdom and guidance to the application of AI and all these technologies that we're going to continue to invent, because that's what we do as a species.
So unfortunately, as usual, we've run out of time. I think, fascinating dive into, the potential for all of this. I couldn't agree with you more in terms of, that frustration with the voice, interactions. And having worked in the industry, I know my family are fully experienced with me roaring at these, dumb agents that, refuse to get me to where I need to get. Because I know Nuance was able to do this. They've been able to do it for years. And I think it's fascinating. Let's just highlight that at the end. Citizens. I don't even know if you've read this book, but Citizen of the Galaxy by Robert Heinlein. And, that came up with one of my previous guests, one of the classic science fiction books that sort of takes it almost to the extreme. And that's, where we sort of think about the future. And it's certainly my path to sort of exploring some of that. But we've run out of time. It's always a pleasure to catch up with you. Unfortunately, this is a virtual opportunity, so there's no physical whiskey involved, but at some point in the future, there will be. So, Doug, thanks for joining me today.
Thanks, Nick. Very, very insightful.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at Dr. Nick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.